cycles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side.
Good afternoon, everyone. Thank you for being here today with us in another session of Vitrolife Group Academy Studio. So it is my pleasure to introduce you my colleague and friend, Bruno Korpersky, who is going to talk about Smart PGT-A+. So Bruno, please, whenever you want,
Thank you.
The floor is yours.
Thank you so much, Nasser. It's a huge pleasure for me to talk about the Smart PGT-A+, and we're going to show a little bit the things that we are doing right now and the novelties that we do have regarding our current PGT-A. So when we think about the Smart PGT-A+, it's our most advanced 4-in-1 genetic test that offers an increased accuracy and also confidence for the embryo transfer. Because when we talk about the Smart PGT-A, we are talking about our current PGT-A that we are going to aim the analysis for the trisomies and also the monosomies. But also, we can incorporate with this analysis the SNP analysis, and we are going to incorporate the ploidy analysis. So in this part, we can discard when we have triploidies or also aploidies. But when we are talking about this new version of our PGT-A, we are talking about the plus, we're talking about also the embryo quality. So we can see about the contamination that we are having in this analysis, and also we're going to have the siblings QC that we're going to provide. So when we think about this and all these 4 analysis, we're going to have the PGT-A, our current PGT-A, and regarding the ploidy and the embryo QC, we're going to need the analysis of the SNPs, the single nucleotide polymorphism. And we're going to do this analysis for every single embryo that we are going to perform. So we have selected a 357 SNPs that we created a custom NGS panel. So in this SNP, we're going to check if completely this embryo has a triploidy or has an aploidy. So how does the Smart PGT-A works? So we have our current protocol of biopsy. It is the same that we are having. We have the blastocyst biopsy, we have the tubing, everything exactly the same. But when we perform the DNA amplification, we're going to have 2 aliquots. So we have one aliquot that we're going to perform the PGT-A, the current and normal one, and the other one, we're going to perform the SNPs analysis. You're going to have the one report as usual. In this report, you're going to have it the aneuploidy analysis, the ploidy analysis, and also the QC embryo analysis. And we're going to provide the transfer of the health embryos. So what are the indications for the Smart PGT-A+? While any couple could benefit from the Smart PGT-A+, the following indications are specific relevant. When we think about the rescue of embryos following abnormal fertilization, say for instance, I have presented an oral presentation here at ASRM, and we saw that we can rescue a few embryos regarding 1 p.m. and 3 p.m., and this is so important for our patients. Reproductive history of aploidy and triploidy, and also recurrent miscarriage or sporadic miscarriage after conventional PGT-A. Complete or partial molar pregnancy, this is so important when we're talking about the triploidy analysis, and also patients with a severe male factor of high rate of diploidy in sperm. Well, as we can see, when we can think about the ploidy analysis, we do know that the haploidy and the triploidy are both compatible with the pre-implantation embryonic development. And we know that the triploidy can be found in around 10% of the chromosomally abnormal spontaneous miscarriage, and is usually not compatible with the developer to term. Well, but what does the embryology says? So when we check the pronuclei, we see that when we have the two pronuclei, we call it the normal fertilization, but we also has the abnormal fertilization, when we have the 0 p.m., the 1 p.m., the 2.1, and also the 3 p.m. So in this paper, our colleague Jose Miravet presented at the PGTIS, we can see that we have an incidence of triploidy in 1.8% of all our samples. So it's a low incidence of triploidy, but it's an important one because we know when we have a triploidy, we have a higher risk of abortions and everything. Regarding also another abstract that we presented, this time at ASRM with our colleague Laura, we can see from different pronuclei checks, we can see the abnormal fertilized oocytes, we have different rates. So when we talk about the 0 p.m. derived blastocysts, we do have a rate of 93.2 of diploidy embryos. When we talk about the 1 p.m. embryos, we can see that we have like a rate of a 35.6% of diploidy. And when we have embryos that more than 2 p.m., we do have a 33.3% of diploidy. So the ploidy analysis and the genetic PN check gonna increase the diploid candidates for transfer after abnormal fertilization or no fertilization, and also gonna decrease the transfer of embryos with the ploidy abnormalities. When we talk about the contamination detection, the contamination can mask the true chromosomal status of the tested embryo. So the undetected contamination can lead to erroneous results and potential misdiagnosis. The PGTA Plus detects an admixture of exogenous DNA, external and also maternal DNA, and our detection ability for contamination levels is between 10 to 90%. We have estimated by our studies that we can have like a 0.8 of all the trophectoderm biopsies can be contaminated. So when we talk about the siblings relatedness, we know that the embryo fingerprint without the need of additional samples from the egg or the sperm provider. So this is really good importance because we just need the embryo biopsy to perform it. So with this analysis, we can assess the genetic relatedness between an embryos in a cohort. We can confirm that all samples analyzed originated from embryos fertilized by the same egg and the sperm source, and we must have 2 diploid embryos. Apparently, in our studies, we can see a mismatch detected around 0.2% of all the samples, and we know the cause for this apparent mismatch, it is embryos derived from different donors and also the true mismatch, incorrect embryo biopsy and tubed. So, to conclude, with our PGTA Plus, we can reduce the risk of miscarriage due to the previously undetected abnormalities. We can increase the number of viable euploid embryos available for transfer. We can enhance the accuracy by reducing the risk of misdiagnostics through the implementation of external DNA contamination detection, and we can provide definitive confirmation that all embryos within the same patients are genetic full siblings, and also ensure the enhances efficiency and quality control in laboratories procedures conducted within the IVF lab, providing a great assurance. So thank you so much.
Thank you very much, Bruno. There's any question? So I know that you yesterday had another lecture, a similar one.
Yeah.
But you had a different kind of percentages.
Yes, we did. Okay.
Because time lapse or not, can
perfect.
you develop a little bit?
Thank you so much for your question. This is a really good one. In our current work, we analyzed the embryos that we are for sure know the pronuclei status because they were cultivated by the time-lapse system. And this is a really good importance one because we have 100% sure that the embryo is a 0 p.m., a 1 p.m., and a 3 p.m. When we talk about the 0 p.m., say for instance, we do have a different results that Laura has because all of them work completely in true 0 p.m. The thing that when you don't have the time-lapse system in your lab, you don't always can be like that 100% sure that the embryo is a 2 p.m. or a 3 p.m. And this is why we had a different type of zeros. Say, for instance, when we talk about the 3 p.m. ones, we do have a slightly less down rates regarding the triplety, but this is a really good importance to regarding like the mixture of between the PGTA and also the time-lapse system.
Do you have any information about 4 p.m. embryos?
Thank you so much for your question, but right now we don't have it. We don't have it. In our study, we just analyzed the 0, the 1 p.m. Laura analyzed the 2.1 p.m. and the 3 p.m., but the 4 p.m. no.
Anyone else? Okay, Bruno, so thank you very much. I'm struggling with my voice. And thank you all for being here today, and see you in the next session. Thank you.
Thank you.
Life, this marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side. life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side. Life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side. life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side. Life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side. life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side. Life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side. Life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side.
Hello everybody, welcome once again at the Vitrolife Group Academy Studio here at ASRM in New Orleans. I would like to present Dr. Robert Green, who is our next speaker, and he's going to tell us about how they've been working with embryo glue over the last years.
Yeah,
Green, thank you.
absolutely, thank you. You know, it's interesting as clinicians, sometimes we don't spend enough time talking and communicating with our embryology teams, but I think it's a great reminder for all of us that when our focus is on the one measurement that matters, which is pregnancy rates and live birth rates, I think it's important sometimes that we have to go back and emphasize some of the things we've been doing that have been really, really working. You know, a lot of times we're criticized in our field for not having perfect data because we don't always use prospective randomized studies. But very often we have something that is biologically plausible that is started for various reasons and found to be useful. And then we have the opportunity over the years to review the data and see whether or not our original assertions were in fact accurate. So what I want to do today is I want to talk about some of the things that have really been thought about as ways for the lab to help facilitate the clinical outcomes of pregnancy rates and live birth rates. And in comparison, there have been many things over the years that have been looked at as ways of trying to optimize implantation and the new term that people are using, placentation, that early development of the placenta. And we're finding that not only may that correlate with our pregnancy rates, but also with our miscarriage risk, and potentially even with some pregnancy-related complications, which have also sort of haunted our patients over the years. Now, if you look at, recent evidence, when there was a comprehensive review looking at 38 different outcomes that have been considered add-ons, there's 3 that really stood out as optimizing our clinical outcomes. And again, we have very clear outcomes: pregnancy rates, live birth rates, miscarriage risks. And when these things occur, it's not news breaking because it's very often things that we've been doing, but that doesn't mean that it's not newsworthy. So I want to take a few minutes and highlight some of the data that's come out about hyaluronic acid and the product embryo glue that can be used to help facilitate what we're all trying to achieve, which is healthy outcomes. Now, hyaluron is a complex macromolecule that we're finding has more and more correlation with health and wellness. If you're looking at various outcomes that are associated with aging, we're often finding that there is a loss or reduction of this important chemical. It's been shown to be an important lubricant. We all hear about dry eye syndrome nowadays, and interestingly enough, there's even talks looking at this as being one potential marker of ovarian aging is loss of hyaluron. But this was proposed many years ago because it's been shown to correlate with embryo adhesion, that first step of attachment. It's been correlating with early development, and studies have also shown improved survivability for embryos that are cryopreserved. So added as part of a nutrient-rich medium that has already been popularized for its, versatile applications, it makes sense that when you look at this and you actually correlate it with the clinical outcomes that we're looking at, it becomes more and more inherent that we understand that even though we don't have one single precise mechanism for how this works, it was originally proposed for its biological plausibility. It adds miscibility, it adds the ability to optimize the adhesion, the attachment. And importantly enough, people are starting to look now at CD44 receptors and how changes in this important receptor and its ability to bond with this molecule might be correlated with some of the adverse or poorer outcome patients that we've all struggled with, looking for newer and better ways to improve pregnancy rates for. So in terms of the supporting data, one of the go-tos, especially for things that have been around for a little bit, is Cochrane Review. And most people are kind of aware that this is a group that is independent of private industry. What they do is they're a group of clinicians and researchers that look at existing studies. We know that every individual study has different flaws. We always talk about strengths and weaknesses of individual studies. whether it's the patient population or the study design or the analysis. And one of the most effective ways we overcome these individual study weaknesses is by grouping studies together. And by doing so, we're able to get larger data sets that represent more diverse interests in terms of patients as well as researchers. And this is something that's been around long enough that originally it was reviewed twice previously and then more recently has been updated so that we now have a collective of 26 studies that involve over 6,500 patients in using this product. And what they found is that clearly we're seeing higher pregnancy rates and we're also seeing higher live birth rates. And it's for this reason that recently at ESHRE earlier this year, when they were looking at add-on treatments, they were looking at a combination of things that have been evaluated over the years, some clinically, some in the laboratory, trying to determine which ones of these things should be applied to, larger clinic populations. And one of the most important things that they found is that an add-on needs to be able to be applicable for most patients. Otherwise you have things that might be appropriate in a limited patient population, but looking things that might have broader use and greater correlation over larger patient populations. And this is, in comparison to many of the other things that have been proposed over the years. Some of them still may have clinical validity, but we don't have enough data yet to support them as being things that should be widely applied. But clearly hyaluronic acid is one of the only treatments that actually got the recommendation, meaning that it could be used in a wide population. But now we're also finding that it may even be more broadly beneficial in some of the most targeted populations that we have to deal with. And these are the patients that are over 35, which represents a large portion of most of our clinical practices. It includes the patients that have recurrent implantation failure, and my goal is to always prevent them from reaching that diagnosis. And I'm pleased to say that we've been using this for many years, and so this is not a population that we later talk about including this on, because we're using this pretty broadly in our clinical setting. And the patients that have no good quality embryos or no GQE. And in these particular patient populations, it's been shown to, again, correlate with higher pregnancy rates and higher live birth rates. And again, the data is broken down for people that are still doing day 3 transfers, for those that are only doing day 5 or day 6 blastocyst transfers. Also, we're also finding that in the recurrent implantation failure pregnancy patients, there may even be a reduction in miscarriage risks. And more recently, there was even the suggestion that there is a higher risk of multiple pregnancy. And I think that's a good wake-up call for us clinicians to continue to stress and push single embryo transfers every opportunity we can. Finally, talking about another emerging patient population that might find this especially beneficial. Previously, it had been found that CD44 receptor that this molecule binds to seems to be somewhat deficient in PCOS patients, which has prompted additional research looking at applying this specifically to the PCOS patient population. And here again, we're finding clinical benefits that correlate to higher pregnancy rates, higher live birth rates, and also potentially reduction in the risks of miscarriage. We always have to be aware of costs based on US data. I don't know why my graphic isn't appearing, but it has been shown to add cost, like everything we do. It's estimated to be roughly about 2% of the overall cost of an IVF cycle as averaged in the United States. So there is a slight increase in the patient cost, but as we all know as clinicians, the greatest cost is an unsuccessful cycle. So anything that might save us from that is probably well worth it to most of our patients. Anyway, I do thank you for your attention. I know that this hasn't been brand new information for most people, but hopefully it's been a nice update and review and something that you could find to be clinically useful for your patient population as well.
Thank you very much. Any questions from the audience at the stage? Just a quick one from my side.
Yeah.
So you use it routinely for all of your patients as a standard protocol?
Yeah, at our center, all of our patients do it. Not only are we using it very liberally in the lab, as a clinician who often gets shooed out of the lab, I'm always in there asking what they're doing. They've even paid attention to some of the more recent data that shows that extended culture for frozen embryo transfers prior to transfer is correlated with higher outcomes. I may even have one more graphic, but there it is. That's our, not our data, but the internal data that shows that, incubating the embryos for a bit longer, we always do a viability scan at our center. So we always thaw the embryos, at least a couple hours before transfer to ensure that they look good. But again, some of the newer studies are showing that a more extended culture is correlated with higher attachment and implantation rates. So again, we're still learning better ways to apply this and finding that the more we pay attention to detail, the better we're getting at it. Yeah.
Dr. Green, thank you so much.
Absolutely.
For being here today and sharing this information with us.
Absolutely. Thank you.
Thank you, everybody. Thanks for tuning in. See you next time. Bye-bye.
Life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side. Life. This marvelous reality that moves us in as many ways as there are people inhabiting this planet. The more we learn about it, its principles, its patterns, and its codes, the more we value being able to help people who cannot conceive naturally. iGenomics was founded in 2009 to work side by side with clinicians in IVF clinics to bring genomics to assist couples fulfill their dream of bringing healthy babies home. Since then, we have brought to light more than 500 scientific publications on reproductive health and processed millions of samples. At iGenomics, we believe that genetics should be available to everyone because important decisions deserve an accurate and personalized diagnosis. We want to accompany you on this exciting journey of life. iGenomics, with science on your side.